Let's talk about the difference between IVH and PVL. Hi, my name's Lisa. I'm an experienced NICU nurse educator, and I too took time to learn things. And PVL and IVH and the difference between the two of them was one of those things. So let's break them down. IVH stands for intraventricular hemorrhage. That means bleeding in the brain's ventricles, so bleeding somewhere where it shouldn't be. It's in stages 1 through 4. You can imagine 1 is kind of minor, 4 is a big deal. And when you look at a cranial ultrasound, it is these circles of white in a place where there's supposed to be black. There's not supposed to be a fluid there. There's not supposed to be blood in the ventricles. So bleeding in the ventricles is IVH. PVL is periventricular leukomalacia. PVL is an injury or a softening of the brain's white matter, usually from decreased blood flow or oxygen, usually in utero. It usually starts in utero. PVL is tied mostly to an in utero experience. You can have PVL after severe IVH. They can be tied together, but they can also be separate, which I think is really important to understand. So PVL is the white matter brain injury from low blood flow and oxygen. This is not a bleeding injury. PVL can lead to cystic PVL, where cysts actually form in the brain. You will see it on those cranial ultrasounds. That's what you're looking for. Both affect neurodevelopment, but one is like a bleeding, things that maybe we can prevent. IVH, we do IVH bundles. Some of it we can't. Some of it is a cascade that starts prior to birth and at the beginning of birth. But PVL is often things that are set in stone, set in motion before we can even begin to help the baby. So those are the two big differences. Knowing the difference between them will help you explain them to parents and help with your understanding and thinking a little bit about the long-term neurodevelopmental outcomes.